Welcome back to your Chapter 11 lecture. This is part 2, and we had just finished talking about what a lozenge was. And so we're going to move on with the liquid oral dosage forms. So syrups are a solution of sugar and water. Sometimes, most often, they do have some kind of flavoring to make it more appealing, and sometimes can have medicinal substances depending on what they're treating. Suspensions and soluble drug substances, they're contained within the liquid. So emulsion is a mixture of oil and water that improves the taste. And gels and magmas are minerals suspended in water. And it's really important with these that you shake before administering or before they take it. Fluid extract is a combination of alcohol and vegetable products. These are more potent than tinctures because they have the combination for absorption. Tinctures are alcoholic preparations of soluble drugs or chemical substance. Extracts are very concentrated combinations of vegetable products or chemicals. These extracts are very strong, so there's a higher potency. Elixirs are aromatic, alcoholic, sweetened preparations. And so these are all the different types of liquid oral dose forms. Elixirs, again, differ from tinctures and in that they are sweetened. You can look at Procedure 11.1 to view the steps to administer oral medications, and we will be doing that. And we will be doing that actually all semester, working on taking doctor's orders, checking them with your 7 rights and your 3 med checks, as well as your dosage calculations to make sure everything's correct before administering any of the oral medications. So there are also mucous membrane forms of the medication. So how are drugs with a rectal administration absorbed? So with rectal administration, drugs are absorbed directly into the bloodstream without being altered, as they would be by the digestive process. Let's say that 10 times fast. And this does not irritate the gastric mucosa in the stomach and all of that when you're ingesting a medication, because it is absorbed directly, rectally, and right into that bloodstream. Vaginal suppositories, tablets, creams, and fluid solutions are used to treat local infections. The mouth and throat membranes may be treated locally with the antiseptic for oral hygiene and local infection, with anesthetics for pain relief, and with the astringents that form a protective film over the mucous membranes. So we talked again about this during our pharmacology. Some nasal preparations, such as decongestants, can cause an increased heart rate, elevated blood pressure, or central nervous system stimulation. So again, it's really important to explain this to the patient. Can you think of a time where we've worked on explaining this to the patient several times last semester? Can you think of a procedure where this happens a lot? Hopefully you are thinking of the nebulizer and your patient education on the nebulizer. Topical forms, lotions, ointments, transdermal patches. Again, these are all reviewed from your pharmacology last semester. Just something to remember that's important is the transdermal patches. These are absorbed slowly through the skin to create time-release systemic effects. So that brings us to the parenteral or parenteral medication forms, and this is where we're going to go ahead and stop the lecture, because this week we're only working on, let's see, we're working on part 1 of chapter 11, and we're going to end our reading at page 258. So we will be looking at these slides next week. Thank you so much. I hope you have a great day, and I will see you in class. It's exciting. We're rocking and rolling. Bye.